Have you ever been told what your due date is in a pregnancy and then maybe had it change as the pregnancy progressed? This can happen sometimes, and due dates can be very confusing when you're pregnant. So we're going to talk about this today and hopefully get some clarification on what is your due date. Welcome to the Dr. Lexi Show, where I break down pregnancy topics into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OB/GYN and Maternal-Fetal Medicine specialist, which just means a high-risk pregnancy doctor. And today we are talking about what is my due date. So what we want to dive into first is expanding our knowledge on this topic. So let's talk about a few definitions. One of the first definitions that your OB provider is going to want to know when they're deciding what your due date is what is your last menstrual period. So before we dive into that, I want to go through what does this mean when we say your due date. So when you have a due date and someone says, hey, what is your due date? The due date is the time in which you are exactly 40 weeks pregnant. So if your due date is on December 10th, you will be 40 weeks along or 40 weeks pregnant on December 10th. So the whole point is to figure out what that due date is for you, the time in which your pregnancy will be 40 weeks along. And so we work on figuring that out with a couple of things. First off is your last menstrual period. So you want to know what was the first day of the last period that you recall having. And your plan is to tell that date to your OB provider. Then what they will do is they'll probably plug it into a program in their computer. What we used to do is we had these wheels, and these wheels would help us figure out your due date based upon your last menstrual period. So they will take your last menstrual period date, they will look at a computer most likely, or a wheel, and they will say based on your last menstrual period, your estimated due date, or the time in which, the date in which you will be 40 weeks exactly pregnant is blank. Let's say it's December 10th. Okay, and then what they will do, they will order an ultrasound or perform an ultrasound in their office. This ultrasound is to try to see if what they have put on the wheel or put in the computer from your last menstrual period is actually correct. So it's like a double check. So they're checking to see if your last menstrual period dating is legit. And this ultrasound has to be within a certain amount of days to say yes or no, that we should or should not base your due date on your last menstrual period. So that's what all that stuff is about. So knowing that you need to know your last menstrual period, that you should be getting an ultrasound to verify that your last menstrual period indeed is the best way to base your due date for this pregnancy. And then the other terminology I just wanted for people to be aware of is something called gestational age. So when someone talks about your gestational age, the reason you have a due date is so we know your gestational age along the way. So if your due date is on December 10th and December 10th is a Tuesday, then every Tuesday when it comes along, you're turning 1 week more pregnant. So if you're currently 22 weeks and 0 days on a certain Tuesday, then next Tuesday you will be 23 weeks and 0 days. So that's kind of helpful for the gestational age to go along and describe how many weeks and days pregnant you are. We refer to it as weeks and days. And then when you're looking at that too, I always kind of have to refer back to this. The highest you can get before you turn the next week pregnant is 22 weeks and 6 days, because then the next day you would be 23 weeks pregnant. So that's how we refer to it. We really don't use months. We use weeks and days, and that's the gestational age, and that's how far along pregnant you are. The other terminology that we can use here is something called a crown rump length. And a crown rump length is something that we can use to measure the length of a fetus prior to 14 weeks. So if you are prior to 14 weeks or anticipated to be prior to 14 weeks pregnant, the way we measure the size of the fetus is from the tip to the bum. We call it a crown to a rump length. And in fact, that is the only time where the fetus is measured in length. Whenever the fetus is past 14 weeks, we do things called biometries, and that will be addressed in a separate section sometime. But the last time we actually measure the length of a fetus is sometime before 14 weeks. After 14 weeks, there really is no length or knowing how tall the baby is. So now when we go toward developing some skills to try to really advocate for yourself during this pregnancy, First off, always know what your last menstrual period is and figuring out if you had regular or irregular periods. And this will help your provider in looking at and deciding upon a due date. So if you'll refer now to this download that I have for you all, this is something that would be very, very helpful for you not only learning the definitions that we looked at earlier, but then knowing the right questions to ask. So if you look on the far left-hand side, we have step 1, and that's taking your last menstrual period and getting an estimated due date at that time. So at this point, if you look at the chart, they might say, okay, you're around 8 weeks or you're around 15 weeks. And at that time, once they've decided where they think you are, how far along you are, meaning what your gestational age is currently, the next step is to do an ultrasound. And that step 2 lists what kind of ultrasound they're doing. And remember, we talked about a crown rump length is something that they look at to see how long the fetus is from crown to rump, or from head to bum, basically. Any time a pregnancy is expected to be after 14 weeks, we can't really do that measurement anymore. We do something called biometries, and we're looking for an estimated fetal weight, and sometimes we call that an EFW. It's a measurement around the baby's head, side to side of the head, the upper arm bone, the upper leg bone, and around the belly. And those things together give us an estimated weight of the baby. So all those things are the options for step 2, which is the type of ultrasound done that's helping to verify your due date. And then step 3 is, okay, let's look at what your due date was from your last menstrual period. Let's look at what your due date was based on the ultrasound we did. And then this step 3 is, if the difference is a certain amount, if it's greater than a certain amount that's listed here, then we might need to change your due date and make it based upon the ultrasound and not on the initial thought due date from the last menstrual period. It can be very confusing. This chart is something that most providers will keep in their office. It's a different chart, a little bit more boring. I've tried to spice it up a little bit here, but this is how we are meant to decide the due date. And the best thing is to decide as early as possible in the pregnancy so that your due date is well established, and so that when we're assessing growth of the baby at some future time, that we can say, yep, this looks like it's agreeing with your due date. The other thing that's important about knowing your due date is it helps you to plan. It helps you to plan things in and out of your day-to-day and your week-to-week. It helps you plan a baby shower. So these are the things that are really important for developing the skills to really understand your due date fully. And finally, for the impact that you can have on your pregnancy, to communicate with your providers about your due date and to help plan your day-to-day and week-to-week during your pregnancy. Don't forget to look at the link provided, and don't forget to check out your free download to look at the process that's involved for figuring out your due date. Don't forget to leave some comments below for today's episode and anything you'd like me to break down in the future for pregnancy topics. I'm Dr. Lexi, and here's to a happy and healthy pregnancy.